Good evening, everyone. Thank you very much for joining this webinar. It is, as you are aware, covering leptospirosis in the breeding kennels. And I will now pass the microphone to Hannah Myler, who will be leading the seminar.
Good evening. I'm very happy to be here this evening and give you this lecture about the leptospirosis in the breeding kennel. My name is Hannah Mila and I'm working at the vet school in Toulouse in south of France as a lecturer in breeding domestic carnivores. And I am working in the research lab which is called NeoCare. And I cannot change my slide. Yes, it works. Let's start with a little presentation of the place that I work, so you will understand why we are going to talk about leptospirosis today, and in the context of what. So the NeoCare Center Laboratory, it's the laboratory dedicated to neonatology of carnivores, reproduction, and breeding kennels. So we are making education as we are at the vet school, of course. I'm working every day with the vet students for the initial training, but also with vet nurses, with breeders, with other veterinarians for continuing education. And I'm also making research on cholesterol intake in puppies, birth weights, growth, microbiota, but also infectious diseases in kennels and catteries. We are giving some services to our clients who are coming to our clinics. And also we have some platform. We have a network, collaborative network with breeders, nurses, and veterinarians here in France. And more recently, 3 years ago, we have opened a breeding kennel here at the vet school. We became officially the breeders of golden retrievers. And this is in the project which aims to follow their health until adulthood, which is called the Toulouse Gold Cohort. So I will say something about the conflict of interest. So I don't have any of them. I have non-conflict of interest as I am not a worker of any pharmaceutical laboratory and so on. So today we will speak about leptospirosis. First of all, we will say what is it, what is the risk for breeding facility, how do we get contaminated with this pathology, this disease, and how can it be prevented in our conditions of the kennel. So as you know, we speak a lot about leptospirosis in breeding kennels, but not only. There is a lot of articles appearing there about the leptospirosis because it's considering nowadays as an emerging disease. There are more and more cases comparing to the last decades. And this is the case for dogs, but this is also the case for humans. There are more and more also cases of in human beings of these diseases. So what is leptospirosis? What we are talking about? This is a serious bacterial disease which can take two different forms. We have acute form and we have chronic form. In the acute form, we have generally the general signs which appear at first. The dog will be weak. There will be some anorexia, some fever, and it can turn very rapidly into the acute kidney injury or acute liver failure, so very serious diseases. It can also appear in some dogs, some digestive signs such as vomiting or diarrhea with blood. And if the dog has any clinical signs, unfortunately, in 50% of the cases, it may die because the rate of mortality for this bacteria, for this bacterial disease is very high. It's 50%. So here you see what we can see on dogs with leptospirosis, so jaundice, as you can see on the gums of the dog, and also on the eyes, the mucosa of the eyes. Or another form, uveitis. So we see the yellow ring around the pupil in the dog sick from leptospirosis. And on the right, it's the same dog a couple of weeks later after the treatment against this bacteria. But this diseases can have also some chronic subclinical form, which is even more dangerous. Because we don't see how it evolve, and there is no clinical signs, and suddenly the dog can become very sick with the kidney failure or liver failure, which will appear. And also this dog will shed the bacteria during the whole time, meaning that the dog will be the reservoir of this bacteria for other dogs, but also for human beings. So which bacteria is responsible of these diseases? What is the causative pathogen of leptospirosis? The species which was found responsible of leptospirosis is Leptospira interrogans, with many different serovars, as we can see here on the list. And this is only a top 10 or 15 of the most prevalent one, but the list is very long. In fact, there is over 200 of different serovars of Leptospira. And this is a very special bacteria because there is many species which will be sensible to this bacteria and which will develop the disease, the leptospirosis. Of course, the dog, but this is also true for sheep, horse, pig, and other animals from the farm. The rats will be not sensible, they will not going to be sick. However, they can be positive if we test for leptospira. And there are some studies ongoing for cats. The situation of cats, it's not that clear, in fact. And nowadays we found that in cats, especially old cats with chronic kidney diseases, but also liver diseases, we found higher prevalence than in those who are not sick from these diseases. So the question is maybe also cats finally are sensible to leptospira, although the studies are ongoing. The prevalence of leptospira, it's worldwide. It's quite high. In fact, depending on the places, we have prevalence going from 0.5 in some South European countries, such as Italy, for example. I will try to show you this. Do you see anything here? No, I'm afraid no. Let me see here. I'm trying to find a solution to show you things on the table, but I'm afraid it doesn't work. Well, yes, there are some countries which the prevalence is quite low, like Italy, but if you look to Iraq, we have prevalence as high as 22%, meaning that it's quite a lot. It was a study in only stray dogs and cats, so probably not vaccinated, but still it means that one dog or cat out of 5 was positive to this bacteria. And in worldwide, if we look to these numbers, finally the prevalence is quite high because it's at about 10%. So of course, I guess you are interested in the data in UK. It's blocked. Ah, yes, it's fine. We will go to UK also, but first I wanted to show you that worldwide also there are many different serovars which are present. As we said before, there's almost over 200 of different serovars of Leptospira which are circulating in the world. And the most common ones are Canicola, Icter hemorrhagiae, Grypophytosa, and Australis. And now what we know about the numbers in UK. So you have a beautiful study made by Royal College in 2021 with a lot of dogs, because there were several thousand of dogs, almost 4,000 dogs included in this study, which showed that the prevalence, general prevalence in your country, it's about 8%, which is not low. In fact, it's quite high. One dog out of 10 would be positive for Leptospira. So if you look, it depends a little bit on the region. So on the graphic, you can see here, the black dots are the clinics, veterinary clinics, who contributed to this study. And the circles show some region with different prevalence. For example, in the blue, up in the north part of the country, the risk of leptospirosis is very low because we have very few positive samples, in fact, none of them almost. But if you look to the south of the country, south west of the country, you see that there is much more cases. And if we look what is circulating, which serovars, there is many different ones. In fact, you have mainly icterohemorrhagiae, surgery, and Australis, 1/3 of each. Almost, but there are also some others, such as Canicola, Grypoptyphosa, and Australis on the south of UK. Meaning that the Leptospira is well present in your island. So leptospirosis, it's a disease of dogs and other animals, but this is also a disease of humans. And in fact, this is the first zoonosis worldwide. So we have almost 1 million severe cases of leptospirosis per year around the world. And we have almost, unfortunately, 60,000 of deaths also per year due to these diseases. And which population is especially at risk? But mainly there are people working with animals, such as farmers, veterinarians, breeders, fish farmers, sewer workers, and also construction workers. So definitely you are in the population at risk of this disease, such as a breeder. So the risk is not very high, but it's still not zero, and you should be conscious about it. There is a study made in Nigeria among the kennel workers. So it was a big national kennel, and in this kennel there were dogs suffering from leptospirosis. And due to the contact with those positive dogs, 15 workers became contaminated and became sick because of this bacteria. So the danger really exists. And what about the risk for the breeding kennel itself? So we know from farm animals that indeed leptospirosis can have some effect on the reproductive performances in those animals. So in bovines, we know that it's a problem in farms responsible for about 20% of problems in the reproductive performances. 3% of the cases of abortion are due to leptospira. According to our French study, there are also some decline in the milk production or super acute form in dairy calves with very, very fast death due to this bacteria. And the pig farms, we know that the prevalence is quite high. It's about 21%. As a consequence of this prevalence and these diseases, we have irregular heat return, infertility, abortion, and stillborn. There is very, very few studies in dogs, but I will try to explain to you what do we know from the literature. We have some cases in stud dogs with the decreased fertility. So there was this study in US on the Amstaff dog who presented orchitis and balanopostitis, so the inflammation of the testicle and of the prepuce and penis of the dog. This dog was not vaccinated against Leptospira. He presented some preputial discharge and unfortunately afterwards the renal insufficiency, renal failure. And after that, the lab results showed that this dog was positive to Leptospira from the subgroup Canicola. So this study shows some rare cases of leptospirosis, which are possible with the consequences on the reproductive tract. But also, Leptospira was demonstrated to be responsible for abortion. We have two cases described in the literature in bitches plus or moins vaccinated. So they were they were not very vaccinated on the good date, or the vaccine was partial with a partial protection. And on those species, what we observed was that at the end of the gestation, the problem appeared. So the bitch did not have any clinical signs. She was perfectly informed, in shape. However, she aborted, and on the fetus we saw some autolyzation, and the placenta were edematous, showing that there was definitely a problem during the gestation on the placentation, which provoked the abortion. And in the two cases, the Leptospira were identified, and they were from subgroup Giaciman and Bratislava. So again, some rare cases, but existing. And finally, some interesting study on newborns. So of course, we would like to know also if Leptospira can be responsible for mortality, such as stillbirth or neonatal mortality in dogs. So we don't have clinical cases described. There is one study made in Italy, so on 121 puppies, either stillborn or dying during the neonatal period. And the authors, they were looking for Leptospira. And in this study, there was none of the puppy positive to Leptospira. So we don't know for sure, but it looks like this bacteria, it's not really a problem for newborn or newborn puppies. However, it may appear again problematic for a little bit older puppies during the pediatric period. So we have this study, quite recent one, on puppy at 2 months of age, non-vaccinated. So at day one, the puppy declared some general clinical signs such as anorexia, hypothermia, mild dehydration. At day two, we saw the jaundice, as you can see on the picture below. And unfortunately, at day three, the puppy was dead. So according to the necropsy and according to the lab results, it was determined that it was leptospirosis with Leptospira from icterohemorrhagia serogroup. So it showed that the Leptospira is present also in the breeding kennels, and there are cases almost in all kind of animals, males, females, puppies, pregnant bitches. So we should be careful, and we should know how we can get contaminated, so we will understand also how we should protect from this disease. So there are two routes of transmission. There can be a direct transmission with Leptospira or indirect one. The direct transmission means that the contaminated dog or the positive dog will contaminate the healthy one. And it will be what is called the horizontal way. In fact, the sick dog or the positive dog will transmit the bacteria in its urines, other projections, bites, via bites with saliva, and also it can happen via contaminated meat, So the healthy dog eating the bovines, for example, contaminated with leptospirosis, with leptospira, can become sick. Another direct transmissions from dog to dog, it's the transmissions from the dams to puppies via the vertical way, via the placenta, because indeed leptospira can cross the placenta and provoke abortion, as we could saw on the clinical case. But this is not the most, let's say, most common route of transmission. The most common route leptospira, it's indirect transmission. So in the indirect transmission, what's going on is that the dog positive for leptospira will excrete the leptospira in the urines, and the urines will contaminate the material, the environment, the food, the water, also the breeder with clothing and hands, and those leptospira on the material or on us or in the water can contaminate a new healthy dog, and the circulation will continue. The problem is also that the leptospira are very resistant in the environment. They can stay there for months. So also the soil can be contaminated with the urines and leptospira, and then the dog playing, digging in the contaminated soil can get contaminated. Mostly via wounds or via the mucus contamination with the oral cavity. So there is someone who is really responsible of the circulation, the main culprit, which is the rodent, the rat mostly. Indeed, the rodents are resistant to the bacteria, but they will really disseminate it everywhere with their urines. So mostly they will bring the bacteria to the contaminated soil, water, but also if they have contact with the dogs, they can contaminate the dogs. And then the dog can contaminate other animals in the farm or in the wildlife or the human being. So we will speak about the dog-mediated leptospirosis, which is well described, even though it's not the dog the most responsible one. So as we said, leptospira can resist very well in the soil. And it's really true, especially in the watery areas, humid areas, such as wetlands, standing water after a flood or heavy rains, and especially in the temperature between 0 and 25 degrees, which means that UK is particularly predisposed to this bacteria, and the bacteria will resist very well almost all over the year. There are some risk factors for this bacterial infection. So we know that in the facilities we will have, where are the rats, we will have the risk of infection 4 times more important than in those where there is no rats. If the environment is humid, there is many rains and so on, then the risk of infection it's doubled. We know that hunting dogs are 3 times more at risk of leptospirosis than the other breeds because of the contact with the wildlife and the environment full of standing water. And also, this is it used to be a disease which was most, let's say, the incidence was higher in the farm conditions. But nowadays, we say also that it's true also for the cities because of the rats. So finally, it's everywhere. And for you as a breeder, there are also some factors at risk. So it has been shown that it was more the prevalence, the incidence of the disease was higher in people working without special clothing during the work, not protected, with open shoes, and also with wounds which were not protected. So now, how can it be prevented? What we can do in the kennel conditions to prevent this disease? Is it interesting to do tests, for example? Indeed, there are some rapid tests which could be done, which vets are doing in the clinics. However, for you, there is really no interest because the contamination could be possible at any time. So we are not going to check your animals every day if they are not positive to Leptospira. So this is really pointless. It's better to concentrate on the prevention. So prevention, as always, is better than cure. To also isolate symptomatic animals, be ready for that. That will be much better than testing animals. So what will be the means of the prevention? First of all, we would like to avoid to introduce the bacteria into the facility. Then we would like to avoid its dissemination once we have some positive dogs. And also we would like to avoid to contaminate ourselves. And we would like to boost immunity of our animals within the kennel. So how to prevent entering the pathogen into the facility? What we should have an objective, it's to prevent the wildlife to enter to the kennel and also to prevent dogs from running out away and be in contact with those wildlife or their dejections. So for this reason, we should definitely demarc installation area and also have it fenced all along. And in the way so that there will be no contact with wildlife. Of course, it will not help with the rats and mice, but it can help with other bigger species such as foxes and so on. Another point important will be the pest control, reducing transmission by rodents. As we saw, they are really the most important vectors of this disease. And how to do it. So first of all, we should keep the manure away from livestock as premises as far as possible. So we would put it really somewhere at the end of the kennel and not in contact and far from animals. We should also avoid to give food to those rodents. So generally speaking, we should store food in the hermetical way in some closed areas where the rodents cannot enter, and also not directly on the ground, but rather on some shelves, as you can see on the picture. And also another thing would be to change the water as systematically as possible, if possible once per day, to avoid that there is some standing water and that can be urines of rodents coming into. And to eliminate rodents, we can use two techniques. We can make physical and mechanical control or some chemical control by biocides. And we should check on those solutions once per week to be sure that put a new one if the previous one doesn't work anymore or there is no product. So I was looking for some solutions how to deal with rodents in your facilities, and I found generally 4 methods that could be applicable to your conditions. So there are the mechanical traps, as you know, cages, swatters, which is the typical, the physical type of pest control, rodent control in your facility. The good thing is that it's not chemical and it's the control, the target control. It gives the target control. However, there is a risk of injuries if it's mispositioned, and it's less effective if we have heavy infestations. So we have to be careful and place it in some special place out of dogs and check them daily. A much more efficient way to deal with rodents would be rather the chemical type of control. So with the secure bait boxes with anticoagulant rodenticides. They are very high effective and long acting. However, there is a risk of secondary poisoning and there are also some possible resistance because the rodents can get used to the substance and it will not work anymore. So be careful and put it always in closed boxes out of reach of dogs and try to change from time to time the active substances to avoid those resistances. Another method would be the anti-rodent ultrasound. Probably you have heard about it. It's an electronical type of anti-rodent solution. It's toxic-free. This installation, it's very easy. However, the efficiency may be variable. And also the rodents, again, can get used to it. The problem may be that some sounds may be disturbing the dogs, so be careful and pay attention how they behave in presence of this solution. And finally, the last solution is to ask some professionals to come to help you with the rodent problem. They will use probably mixed type of solutions. They will make, first of all, accurate diagnosis. They will make some complete treatment with different types, as we said. Although it may be quite expensive and we will have still some time to respond. You will need to work with certified provider to be sure that they work well, and also you will still have to do follow-up to be sure that it works, and ask the company to come back if it's not the case. Second point would be about how to avoid the dissemination of Leptospira once you have a case in your kennel. So if you know that you have a lot of rats, if you had some problems back then with Leptospira, you should definitely think how to avoid to spreading it within your kennel. So first, you should avoid standing water. And also try to have easy approach to cleaning, so some easy conditions to cleaning. To avoid standing water, think about solutions such as on the picture on the left. You can see that there are some slopes on the ground. It's not dry, it's not completely flat, and the water, it's not standing there, but it's getting into the hole in the middle. Meaning that there will be not waste water disposal. There will be no standing water in this kennel. And on the right, you can see space for the animal, which is very pure. There is no much inside, which allows to clean easily those places, and there will be no place to hide for rodents. So yes, the hygiene protocol will be very important because we will eliminate the bacteria from the environment, but also we will avoid that the rodents live in the place where we have our dogs. And this cleaning protocol should be do correctly, which means that we have some steps to follow, and we cannot skip those steps because then it will not be as efficient as it should be. So what are the important steps of cleaning? So you should definitely always start with the cleaning up of litters and droppings in the box. Then once it is empty, you can go to cleaning, mechanical one and the chemical one with a detergent. So brush and use something like a Mr. Prop, maybe you know it, we have it in France. Generally, it will be soap products. And this is really the most important part of the cleaning because you will remove almost 95% of the all pathogens just thanks to the cleaning. And it should be done really often, like once every 1 day in the maternity. And in adults, if you don't have any problem, you can do it only once per week or 2 times per week. Don't forget to rinse the surfaces after cleaning to don't have the products staying on the surfaces with the animals. And then you can go to disinfection. So the disinfection, which will be recommended to avoid Leptospira in the kennel, would be disinfection with the bleach at the solution of 2% to prevent it. And it should be done 2 times per week. And then again, we rinse it, we dry, and then we can introduce animals. So again, drying, it's very, very important because as we saw, Leptospira are very resistant, especially in humid environment. Another solution to limit the contamination of other dogs once we have a positive case of Leptospira will be isolation of the sick animal. So we should have the infirmary for this reason. So the place only for sick animals, easy to isolate, easy to clean, easy to handle sick animals. And we should keep the dogs there until the end of the treatment, which is quite long. If we have leptospirosis treatment, so antibiotics, it will last following several weeks, and the dogs should stay in the infirmary during the whole period. If you are going to handle those dogs, don't forget about chew, don't forget to protect yourself, as we said, so rather use gloves. And don't throw away all the material in the classical rubbish. You should rather use a special one, rubbish for this hazard material. And if you are going to clean those place, or rather when you are going to clean it, think about the disinfection as well with the bleach, but this time we would rather use 10% solution and not only 2%, because we know that we have Leptospira, and it has to be done really every day if you have sick animals. And how to avoid contaminating yourself if you work in the kennel. We spoke about a little bit according to the sick animals, but also think about systematic hand cleaning, just simply. Think about suitable clothing when you are cleaning premises, so rather full shoes. And also think about protection of your wounds if you have any, because as we saw, this bacteria can go through the wounds and it can you can get contaminated in this way. And finally, the immunity, how to boost the immunity in our animals. We have, in fact, no studies in very small puppies. We don't know what about the colostrum role in the Leptospira in dogs. However, we have some studies in other species. So for example, this one in pigs. This study, the dams had a high level of antibodies in their colostrum. And so when the piglets got some colostrum from the mother, they acquired the immunity also against Leptospira. And this is a good thing because it means that during the first weeks of life, they were protected against the leptospirosis, against the Leptospira. However, the protection was not that long because it lasted only for 8 weeks and it was only partial protection, which means that we should definitely continue to vaccinate the animals in the kennel and also vaccinate the puppies if they are at risk as quick as possible. So in dams, we would like to vaccinate them to reduce the risk of abortion, because we saw that this bacteria can be responsible of abortion. But also the other point which could be interesting is to protect puppies, because we would boost the colostral immunity, and so puppies will drinking colostrum would get some immunity against Leptospira, even though we need some studies to demonstrate it in the dog. And in puppies, we would like to vaccinate them just simply to reduce their risk of infection once they will be in the contact with the surfaces eventually contaminated by Leptospira. For the cats, I know that you are not breeding cat, but just for your information, actually we have no vaccinations which are proposed by any laboratory. So if we go back to the UK situation, we saw that there is a lot of serogroups circulating in your country, and definitely if you are going to choose your vaccination, please think about the complete vaccine, because in this way you may protect them against a maximum of serovars of Leptospira, even though it won't be 100%, because as we saw, there are hundreds of them circulating in the environment. So in conclusion, we can do a lot of things to protect you and also your animals from Leptospira. We should think about the pest control, the limitation of the kennel to avoid bringing Leptospira to the kennel. We should think about the hygiene and materials to construct the premises. We should think about the staff hygiene, and we can stimulate the cholesterol intake, and we can vaccinate them to boost the immunity against Leptospira. And I have finished. If you wish to have some articles about the neonatology, about the reproduction, about the breeding kennel, don't hesitate to go to our website, which is called NeoCare Pro. We have the library there, which is free. You can go and take what you want, what you are interested in. And also you can join us on our web network from time to time. I promise you it's not every day. We are sending you some new information, some new documents, some new research interesting from breeders. And we are sharing all what we can in this thanks to this network. So I have finished my presentation, and what I propose is to start to answer your questions. Kira, do you hear me?
Can you hear me there?
Okay, so I will answer the first question that I have in the chat box. So you have a special box to ask your questions, and don't hesitate to go there. Question and responses. And I have one. Will the slides be available to attendees? Well, we are registering the whole Zoom. So I think what we will do, it's rather than slides, we will put all the video on the YouTube, and then I will give it to Kira so she can send you the link. Is it fine for you, Kira?
Yes.
Perfect. Okay. Do we have any other questions? Do you vaccinate against Leptospira? You can put it directly in the chat. How many of you vaccinate dogs against Leptospira? Okay, there is Anna who vaccinate. Some more people. Okay. Is there anybody here who had any problems like leptospirosis in your kennel? Do you have any specific questions about it? So one person says that have many puppies died from the lepto vaccination? This is a question. Okay, so yes, I do had no issue to date. Okay, so Judy had leptospirosis, if I understand well, but now it's getting fine, so this is perfect. Is there any medical issues vaccinating puppies with lepto for? So I guess, well, in France we have a lot of breeders who are afraid of Leptospira vaccines. And I spoke with Kira just before that this is also the case for you guys in UK. In fact, if we look to the literature, there is one article we have, at least in France, quite recent one from the December 2024. And it was someone who, from the our veterinary security establishment, let's say, who did statistics about it. So what they did is to take all the formula which were sent by veterinarians and breeders complaining about the vaccine. And in fact, there were very few of them. So they concluded, among others, that finally this is something that is not really very often. You have to know that we vaccinate a lot of dogs against Leptospira, and there were only few formulas written as there were any side effects of the vaccine. So I don't think it's really often that it happened. It may happen as it happens with any other vaccines. It may happen to have side effects because this is something that it's written in human medicine, in veterinary medicine. It's the allergic reaction, which is which may appear general one. So we'll have a puppy who is swallowing. We may have some rash on the abdomen. We can have some eyelids swallowed, and the puppy which is quite weak. This is something which is, of course, known, and this is known for leptospirosis vaccine, but also parvovirus and others. And in this case, we have to go as quick as possible to the vet and ask for some treatment. And even, in fact, very often it appears still when we are still at the consultation, but because it's in the first 30 minutes after the vaccination. So if you are afraid of this kind of side effect, you should wait in the clinic, not leave directly, but wait at least 15 minutes to check if your animal is fine. And if it happens, then you can react very fast, and you can, of course, say to the vet that something is going wrong, and they will administrate the medicines. Other reaction that we had after the lepto vaccination, so lepto 4, was rather local. So it was not really serious for the animal. There were some limbing, for example. There were some inflammation locally, but it passed quite fast. During the first 24 hours, everything was resolved. So this is not something that is going to be very dangerous for animal. This is just the inflammation locally due to adjuvant, something which is in the vaccine, which will stimulate the inflammatory response and stimulate the immunity to boost. And in some cases, they react quite strongly, animals, and we can have local inflammation. So I would say, no, it's not dangerous to do it. In our kennel with Goldens, we used to do it all the time at age of 2 months. And we didn't have any case of death in those animals, although we had indeed some anaphylactic reactions, allergic reactions to the vaccine. Well, it was mixed between parvovirus, distemper, and leptospirosis. So we don't know against which one we have the reaction, but indeed we did have some of them. So it's the risk that you will take if you vaccinate. It's the same risk as we take when we are vaccinated children, but as we are doing it in the control conditions, just next to the human doctor or veterinary, we can react quite fast if it happened. So it's in controlled conditions. Let me see other questions. what age would you recommend vaccinating puppies with L4? According to the pharmaceutical labs, it's not possible even to do it, is not recommended to do it before age of 8 weeks. So you can do it as early as 8 weeks of age. And this is what we are doing with our Goldens. However, if you don't need to do it, you can wait 1-2 weeks more. It depends also on the conditions of your kennel. If your puppies at 8 weeks already, they are going out, there is a possibility that you have some rodents in your kennel. There is some grass and you cannot control, in fact, what they are going to put in their mouth and so on, then you should do it as quickly as possible. But if your puppies are rather in the closed conditions, everything it's easy to clean and there is no sole, then maybe you don't need to do it right away at 8 weeks and you can wait a little bit longer. Yes, I do vaccinate and I have never had issue to date. Very good. There are a lot of UK breeders who do not recommend puppies be vaccinated with Lepto4 as there have been deaths. Well, as we said before, it depends on the context. Is there any proofs? Are we sure that it was vaccine or not? Was it an anaphylactic shock or other things? We cannot state if it's true just because there are some information circulating. We should, in this case, at least call the establishment responsible for medications in UK and try to make a statement, official one, so they can explore the case. And if it's really due to the vaccine, then they will report it and they are obliged to do it. But if we don't say it to anybody and we're just saying it to the colleagues on Facebook, then it's complicated to understand what really happens with this puppy. How long does vaccine last for? For the first vaccination, you will do it twice. If you start, let's say, at 10 weeks of age, then you will need to do the second vaccine 4 weeks later, so that the puppy will respond correctly to the vaccine and will develop the long-term immune. And then you will need to do it every year. This is different than the vaccine against parvo or distemper. The immunization has to be reboosted more often, so every year, so that the vaccine will last. If not, if you wait 2 years or more, you will have to start again all the process of the vaccination and do the 2 injections 4 weeks apart to rebuild all the immunity against this disease. Why have they decided to add the new strain to vaccine? So indeed, at least in France, we will not have Lepto2 anymore on the market. Now we are going to have only Lepto4. They decided to add some more strain because of this circulation. As I show you the results in UK, we have the same in France. And they realized that, in fact, there are Leptospira circulating from 4 different vaccines at the high level. And this is why they decided to put one more strain to protect even more against more strains, not only 2, but 4 in our case. I'm a vet nurse at a very busy practice, and I have never seen a reaction to the Lepto vaccine, but have seen a few dogs die from Lepto. So many clients are refusing the vaccine now, and I fear we will soon be seeing many more cases. Yeah, I agree. I definitely agree. So you in UK, you have a lot of cases, in fact, of Lepto. It's not just 10 or 20, it's much more. And this is only the dogs that we were able to follow and have a sample. Which means that if we take 100% of the population of the dogs in UK, it will be even more positive dogs. So I agree that we have this chance to have the vaccination. So why not to use it? And unfortunately, of course, there are some side effects as in every drugs. But again, if we control the intake of the vaccine, if we stay at the clinic, vet clinic, and wait enough, then we can see those puppies and we can react fast and not go to death. And I don't think it's really often that it happens. As the study shows, it's really very rare cases, in fact. So I agree with you, Joanne, and thank you for your remark. And I think I answered to all of the questions.
Mila, can you hear me?
Yes.
Right. There is a question there where it says, I missed this, but what are the most common strains in the UK now? That's in the webinar chat.
Okay. So I will show you once again the data for UK. Let's go back. So honestly, you have a lot of very, very good data in jealous sometimes because we don't have it in France. And this particular study is very well done by our colleagues from Royal College who are working on epidemiology in dogs and cats. And you see they got results for Leptospira detection in almost 4,000 cases. 4,000 dogs. And you see that the prevalence is almost 8%. So 315 positive dogs in this only in this study. And if you look what they found, they are saying that mostly there are three serogroups which are circulating: Icterohemorrhagia, Seroi, and Australis. But also you have some others on the graphic on the left part, the group D, the circle D, in let's say light blue color. You see that there are also some Canicola, Grippo tifosa, and again Australis, which are circulating, particularly in this region, which is different from the north or from the center of UK. So you have a lot of them, in fact. Here are the most represented ones, but there are some more even.
Hannah, can I just ask a question?
Yes.
The D group, even if they were vaccinated for L4, wouldn't be covered.
I cannot tell you. I don't remember if it was written how many of those dogs were vaccinated and against what. I will have to go and dig a little bit more those results to tell you. I can, of course, give you some more information, or you can also go to this publication. You can see it's in the Preventive Veterinary Medicine. You have all those data inside. Also, how many of them were vaccinated when, which vaccine. So don't hesitate to look for because I don't remember now. Sorry.
Thank you. There's one more question from Fiona Morris.
Okay, let me see. I'll stop this one. Okay, do you believe that breed clubs in UK should be recommending Lepto 4 over Lepto 2, which is still available? According to what I heard from my colleagues working in some industrial companies, the Lepto 2 will disappear from the market. So very soon we will have only the version with 4 different strains. So for the moment, when we can still have the two ones, I would say that if possible, If you have animals not sensible, I mean, you are not afraid, you didn't have any side effects and so on, you should definitely go for Lipto 4. If you still think that it would be better for your animals for whatever reason, it's always better to do Lipto 2 than don't do anything. But soon you will have no choice, in fact, and then there will be only Lipto 4 available on the market, from what I know. I hope it's what you were looking for as a question, and it answer your question. Okay, so I think I answered to all of you the questions. Kira, do you have any questions? Is it fine? We
It's
can.
fine. Thank you ever so much for taking the time to do this presentation in English for us. It's very much appreciated.
Thank you so much for the invitation, and I hope you understood my English.
Excellent.
Thank you so much. Have a nice evening, everybody.